is such an important conversation. While May is Mental Health Awareness Month, today we're focusing specifically on children. Anxiety, depression, ADHD on the rise among elementary, middle, and high school students.
Yeah, New York City leaders say social media is to blame for youth mental health crisis, but the experts say the problem is bigger than that. It's bigger than TikTok or Instagram. So here to give us some more insight is the Associate Clinical Director of the Kids Mental Health Foundation, Dr. Whitney Reichland-Bignall. So Dr. Bignall, thanks for being with us this morning.
Yes, thank you so much for having me.
I mean, the city went to the extent of suing social media companies because they say they're fueling mental health issues with children. Do you really feel like it is social media that's the main issue when it comes to the mental health of children, or do you think it's something much more than that?
Honestly, we don't have research that can say this one thing causes the crisis, and we know the crisis has been going on for many years, and so I really do think it's multidimensional. I think, yes, that's a part of it, but you know, the Surgeon General released a report about loneliness. I think kids are lonely. I think they're anxious about the future. So many studies have been coming out about eco-anxiety, all this climate stuff going on, and kids just are unsure. I also think that kids are just not as connected as they once were, and so I think there's lots of factors, and so yes, I think social media has a part to play, but there's so many parts that I think we still have work to do.
Why?
With the pandemic, too.
Well, the
Yeah,
pandemic,
yeah.
that certainly has something to do with it.
Definitely. I think that the pandemic, the trend was already there, and then it just kind of expanded. Like
Yeah.
it was like a light that kind of set it on fire in a sense of made it worse.
So could that have been the catalyst? Because we said anxiety, depression, ADHD on the rise. Was the pandemic the catalyst for those things, or what are you seeing as the driving factor of those three things becoming on the rise?
Well, what I think of, especially anxiety and depression, are the two that I think are really on the rise. And I think the trends, even in 2019, I saw an increase. Like, you know, I see patients in my clinic, and I was noticing in 2019 an increase. But then we know things such as isolation and getting out of your routine can really hurt your mental health. And that is what I think the pandemic ended up doing. We were less connected. And so then we've struggled to connect when we are back together, right? And kids are often talking about not having the skills to make friends or uncertain that they belong. And those are things that we actually have resources on our website about specifically, because those are the things that I think are sometimes driving some of these loneliness and anxiety and depression.
Yeah, and that's the problem, though. When everyone was stuck inside, they were turning to social media to connect. A lot of kids getting on Instagram, on TikTok, and that's where they saw these influencers. Now you're seeing these Sephora kids, and they're thinking everything they see on social media is reality. So do you feel like we shouldn't allow, at least at a certain age, allow our children to have social media accounts because of this?
So I do think that obviously there's going to be age restrictions, but I don't think there's a certain age. I want parents to really know their child. Is my child mature enough? Are they showing me that they can ascertain what is real and not, or know what's safe or not, and having conversations? If you don't have an open relationship with your child, I wouldn't want them on social media, because I want parents and children to be talking about what they're seeing, because if you're not able to do that, then yes, they can easily get caught up in what they're seeing and not able to say, like, I know that person's photoshopping that and that is not real. But if they're not having those conversations, then who's there to check that? And so I really want parents to be thinking more about the maturity of each of their children versus a specific age.
And that doesn't just go for social media, it goes for all media.
All media,
right?
yes.
So how do you have that conversation as a parent with your child, some of them teenagers or even younger, who don't want to because they're like, oh, you know, leave me alone, you know, and they want to, and so it becomes an internal struggle for them.
Yeah. I hear this from parents all the time, because number one, you don't want to be the bad guy. Don't you see that preteen
all the other kids are doing it,
coming up to you like, but my friend has it and I'm going to be left out. And so I think it is an important conversation, and you should start it early. I mean, and so we actually have resources on our website that helps parents have conversations about social media and media in general. Because I think you have to start early. Why do they want to go on there? Who do they want to follow?
But also,
how do they stay safe?
The way to have the way to approach.
Way to approach it. That's what we have the resources. How to have that open conversation. And I think it's so important to be open. So often as adults, parents, we come in and we're ready to just like kibosh, you know what I mean?
Yeah.
And I think we really have to have an openness to see where they're coming from and then talk about it in a balanced way. Because I think we are on social media as adults, right?
Exactly.
We are showing them how to do it.
Yep.
So they're looking at us to be a good role model. And so I think we have to be honest about what we're doing and talk as a family about that.
Yeah, because you're a part of this panel today talking about how you talk to your kids, right?
Yes, because I think, you know, with a plan, then we can all talk about how to be balanced. Because in everything we need balance, and so too much social media, too much media is not good for anyone, with just like most things. And so as parents, as caregivers of the kids in our lives, we have to be having those conversations. We actually have a family plan on our website so parents can talk through
Good to know.
like what as a family we're going to do to make sure we are balanced with media.
Doctor, thank you so much for your insight on this conversation. You got to come back. We could talk to you for
Yes.
Yeah, ever.
forever about stuff like this.
I love
Okay,
it.
good to have you. Good luck with the panel today.
Thank you.